Welcome everyone to today's seminar. So it's going to be about the impact of COVID on our university student mental health. And our facilitator today is Kim Spain. She's the Senior Mental Health Advisor for Student Disability Services at Campus Life. And she's passionate about advocating for students with mental health conditions. She has a master's in counseling from the University of Auckland and is a full member of the New Zealand Counselors Association. Kim, welcome.
Thank you. Tēnā koutou katoa, everyone. Hi, my name is Kim Spain, as Julia said. I'm the Senior Mental Health Advisor for Student Disability Services. A bit about our service. We offer wraparound support to mental health and academic support for students with diagnosed mental health conditions. We see students from all faculties, undergraduate, postgraduate, international and domestic students, during practicums and during their research. We support students when they're not doing so well. So for example, they're in the midst of a psychotic episode or they've been admitted to hospital, they may be having a depressive episode. And of course, we support students when they're doing well as well and when they're thriving. So yes, as Jolie said, I have a master's in counselling and a background working with adults and young people in addictions and the education sector for the past more than 20 years. And yeah, since the onset of COVID-19, we've seen an increase in students accessing our services due to declining mental health. So this aligns with research undertaken since the onset of the pandemic, which highlights the key areas of concern for people in the community as well as in the university population. So I wanted to share with you a bit of the latest research and implications on our mental health, as well as instill some hope and inspiration to you, hopefully, despite this, that we can find ways to empower ourselves and sustain us moving forward as we're still in the pandemic. So yeah, this sort of research is more so on last year. I haven't included potentially new research that's been done over this year, which may have surfaced recently. So yeah, if you have questions, you're welcome to put them in the chat. I may not have time to get to everyone today, but you're definitely welcome to send us an email and I'll put up an email address for you if you'd like to, and I'll follow up with you after that. Okay, so firstly, I want to sort of start with something a bit personal for you. So I want to encourage you to get a pen and get a piece of paper, and I want you to write down three things. The first thing is someone that means something to you. So it could be someone in your life, it could be someone you look up to, someone who's influenced you. They don't necessarily have to be alive, they could have passed away already. But yeah, write down someone that means to you, someone means something to you. Secondly, something that you want to accomplish or see finished. So it could be a project that you're working on currently, or it could be a future hope, something that you want to do in your life. And thirdly, something that you get excited about. So I guess if you think, you know, what would I be excited about? What would I get up at 4 in the morning to do that I'm so passionate about it? So yeah, I'll just give you a little bit of time. So just think about that, write down those three things, and then we're going to come back to them later on. Right, I hope that's enough time. Okay, moving on. So let's sort of start off with what we knew. So there was a study done in 2018 before the pandemic, KTPI, this report on New Zealand student mental health. The key points from this report was that university students are actually a higher risk group for mental health concerns compared to their non-university peers. So this could be due to financial stress, moving away from home, navigating new processes at university, things like that. As well as this, the average age group that people start at university can sometimes overlap with the average age of onset of some mental illnesses, for example, depression, anxiety, substance abuse. And actually, we've seen some students who are in their first year at university and have also presented with their first psychotic episode. So there can be some overlap there. On top of this, the reports talked about the higher risk student groups for mental health concerns. So we've got gender minorities, sexual minorities, students 16 to 20 years old, students with other disabilities, students who are enrolled in a certificate or an undergraduate degree, students taking creative arts or information technology type studies, and also cannabis users. And this report sort of said that as a result, about 20% of students would drop out of their studies due to mental illness. And actually, quite interestingly, that more than 50% who believed they had a mental health condition actually had no official diagnosis. So they believed they were having mental health struggles, but they never reached out for support or they never got diagnosed for that. So that's a bigger chunk of students than what we're seeing currently. Protectively, the study talked about the protective factors for these elements in our lives that buffer risk. So the more protective factors we have, the less the risk factors can impact us. So it's important to focus on protective factors as well. So those who believe their studies were going well, regardless of their grades, that was actually a protective factor. And I have seen students who, you know, they might be getting C's, but actually that's really good for them and they're happy about that. But then I might have students who are getting A's, but it's not good enough. So they've really put the pressure on themselves. So perception of how you're doing it at university is a protective factor. Another one is supportive living environment. So where you're living and who you're living with and, you know, feeling safe and all of those sorts of things, that's another protective factor. And then lastly, those who felt good about their financial situation. So as we know, being a student is you're not getting paid to do the work, you have to pay to study. So of course, then you have to figure out how you're going to get money. So that's always going to be a stressor in students' lives. So moving on to sort of the impact of COVID in general on university students. So there was a small study done in the University of Waikato on the impacts of COVID-19 on university students back in March 2021. And so obviously this was done before the lockdown that we had from August to December in Auckland last year. But the impacts that they sort of discovered were loss of interaction with lecturers and peers, delays with conducting research, lack of access to labs and interaction with participants, lack of a quiet place to study, and reliable internet connection and privacy of that as well. So impacts mentally for that was increase in concentration issues for students, reduced performance and perception of an increased workload. So potentially not increased, but feeling like it had increased. Increased anxiety, especially for those with learning disabilities, and an increase in negative emotions, including boredom. And students actually experiencing less hopefulness and less joy. And this study also pointed out higher risk groups were those who were under 25, were at higher risk of having learning issues and experiencing negative emotions. Full-time students were impacted more than part-time students due to the greater pressures, and they were more likely to feel hopeless. Students who had means to pay for their living and studies had a higher level of resilience compared to students who did not, regardless of whether they lost their job or not. So that's sort of a theme that we can see, carrying through is financial stress and having means to pay for their situation. So the result was less enjoyment of studies, less confidence in mastering skills they had learnt, maybe due to the online teaching environment, and a worsened performance. Protectively, those with support networks had a better coping ability. So again, having the right support around you is a protective factor. So the impact of COVID on people who already had a mental health diagnosis. So there was a study done in Otago which compared students with a mental health diagnosis to the impact and the impact of COVID compared to their peers. And what they found was that 32% of students who reported their mental health had deteriorated as a result of COVID. These students were 3 to 4 times more likely to experience suicidality and plans to end their life compared to those who didn't, without mental health diagnoses. Increased isolation, of course, worried about finances. Those with a mental health diagnosis had increased health issues as well compared to those without a diagnosis. So it was sort of the mind impacting the body as well. And this study didn't really point out protective factors, but it did suggest that perhaps during lockdowns or these sort of restrictive times that it is really important to prioritize people with mental illnesses and make sure they can still access support services and still be able to connect with others. So a bit about our service, mental health support. So if we look at our service from 2021, again, supporting students with mental health diagnoses. And look, this is a drop in the bucket compared to the total number of students needing support. As what we'd seen in that original report is that 50% of students who felt they had a mental health diagnosis had not got a diagnosis or potentially reached out for support for that. So yeah, and in 2021, we are a 2-person position, but we weren't necessarily operating at that capacity due to staff being on maternity leave as well. So in 2021, we received 305 new referrals. We saw 374 students in total, including during lockdown, which was an increase by 34 students since 2020. We had 837 appointments by face-to-face, Zoom and phone calls. And the main diagnoses that we saw were anxiety at 32%, depression at 29%, and ADHD at 15.4%. And then obviously we saw a range of other students with other diagnoses as well. And the key issues that we saw were loss of motivation, you know, losing that routine, having to push themselves to study and do that work, isolation, you know, being disconnected from their campus, their community, their peers, having to move back to their family homes, so having to leave university accommodation or leave their flat to go home to a different environment, disconnection with helping and support services, so not necessarily being able to see their mental health support team or not being comfortable having a Zoom appointment for that as well. Death of a loved one and not being able to attend a funeral, which again has affected, you know, the whole of New Zealand really. But for students not being able to travel or being stuck overseas, and then, you know, the implications of that on their studies. Not being able to maintain their usual self-care strategies. So a lot of students that we see, they really are set up really well with supports. They've got their strategies for self-care. They know how to look after themselves when they're not doing so well. But yeah, when that's limited, of course, that's going to affect people's mental health. So the outcome was that, yeah, there was an increase in late deletions, so dropping papers, supporting students to request extensions for their assessments, applying for aggregates and compassionate consideration, and students stopping their studies altogether or taking a break because they just weren't it wasn't helping them to study online in that sort of capacity. And then also sort of later on would be students who chose not to be vaccinated and the implications on their studies and not being able to access campus for that period of time. So I want to switch gears a little bit here, and I want to introduce you to Viktor Frankel. You may have already heard of Viktor Frankel, the founder of logotherapy. He was an Austrian neurologist, psychiatrist, philosopher, and author. And during the Holocaust, Viktor became a prisoner in the concentration camp. He was already exploring his theory of logotherapy and creating this. And so when he became a prisoner in the concentration camp, he used this experience as an opportunity to observe prisoners and notice them, with the themes on survival and death, and how they're sort of surviving in these horrendous situations. And as a result, he wrote the book, Man's Search for Meaning, which I recommend you read if you haven't. It's really, really interesting. So I'm just going to play you a short video. I hope it's going to work on here. And it's just a little bit about Viktor's, his studies.
Despair. During his days in the concentration camps, he noticed a division between two kinds of people, those who had given up on life and those who had not. The first group was more prone to illness and death. The second group was more likely to survive. The difference? A sense of meaning, or more specifically, the discovery of purpose in their unbearable living conditions. For example, Frankel himself was a doctor and found purpose in helping the inmates who suffered from illnesses. One day, he refused an opportunity to escape the camp so he could stay with his patients. He wasn't motivated by money, status, power, or even freedom. His purpose, in his case, taking care of his fellow human beings and not abandoning them, was so important to him that he was willing to die for it. His life had become a sacrifice of most profound significance. On the other end, Frankel wrote about those who collapsed under the harsh conditions of the camp. They always had the same reasoning for giving up, and I quote, "There's nothing anymore to expect from life," end quote. Devoid of meaning and faith that things could turn out more favorable, our bodies and minds begin to wither as we have lost our will to
live. Sorry, that last bit was supposed to say. So yeah, Viktor Frankel found there was two groups that he observed during the Holocaust with the prisoner population. Those who had given up on life were more prone to illness and death, and those who hadn't given up on life were more likely to survive. And the difference was that a sense of meaning or a discovery of purpose in their unbearable living conditions. How does that happen, you ask? As our minds give up, so do our bodies. So I guess that says that there is something about our mind that can overcome our physical body. So in this situation, the protective factor is finding meaning, purpose, connection to others, and the way we choose to see our situation, so much that our mind can overcome our physical ailments. And even in that video, Viktor says, it says that Viktor himself found his own meaning and purpose for being in the camp was to complete this project that he was working on to create logotherapy. So I just want to read a quote. Read a quote to you from Man's Search for Meaning. So even though conditions such as lack of sleep, insufficient food, various mental stresses may suggest that the inmates were bound to react in certain ways, in the final analysis, it became clear that the sort of person the prisoner became was the result of an inner decision and not the result of camp influences alone. One more quote for you. Same book. There is nothing in the world, I venture to say, that would so effectively help one to survive even the worst conditions as the knowledge that there is meaning in one's life. So what does this mean for us students with so many hardships students can face? Time pressures, financial stresses, isolation and disconnection, not including mental illness. Another study was done in Germany on mental stress during the pandemic and the impact of personal meaning in life as a buffer. So what they found was that people who saw meaning in their lives and who were capable of self-control reported substantially less mental distress. Meaningfulness and self-control also served as buffers between COVID-19 stress and general mental distress. So when COVID-19 stress was high, the presence of meaningfulness and self-control accounted for lower general mental distress. I am not alone. Connection is a mindset. The pandemic, yes, has been an isolating experience, and even studying itself can be an isolating experience. And students often talk to me about how they feel alone and they don't have any friends. And they think everyone else does. They look at everyone else and think, oh, they've got a group of friends, they've got a group of friends. But there is a myth that people have a large number of friends in their lives, when actually most people can count on one hand their closest friends. Another thinking error is that thinking about a group of people we want in our lives, you know, the ideal group of friends, and focusing on the fact that we don't have that, when actually there are people already in our lives. So the idea of community doesn't always look how we want it to look. So we must rewrite our understanding of connection with others, not focus on what we don't have, but what is right in front of us. So those who believe they're well supported and have people in their lives will feel less alone. And this belief can help us to overcome adversity and is a mindset without actually changing anything else. So obviously we don't want to compare the Holocaust with the pandemic, because the Holocaust is a much different, horrible situation, but we're looking at adversity and how we're coping in adversity. And if we look at those in the concentration camp, and us as an example of going through the pandemic, the group support is immense. And even though the physical effects of trauma are profound and systemic, and yet with good support and therapy, compassion and care, we can survive and prevail despite experiencing horrible events. So again, I want you to pick up your pen again and your paper, and I want you to write down 5 people in your life. So it doesn't matter who they are, from what capacity, 5 people who could potentially become your community. Is it someone in your university accommodation, your flat? Is it a neighbour? Is it a local cafe staff person? Is it someone you see in the playground if you're a parent group, or someone in your tutorial? So I just want you to have a think, because there are people around us, and sometimes we can sort of hold on to that safety net of just looking at our phone when we're in public without actually looking around and saying, who can I potentially connect with right now? So I'll just give you a little bit time to just think about that and write down some people. Okay, so let's go back to the 3 questions I asked you at the start and the answers you wrote down. A pandemic, although, as I've said before, not comparable to the Holocaust, it does bring a level of adversity to us in all different forms. As well as what has already been mentioned, we experience loss of control, loss of future plans and goals, loss of finance, loss of student experience and campus life, increase in suicidality and increase in inner struggle. Viktor Frankel's experience during the Holocaust shows that no matter what adversity, no matter what horrendous conditions humans are put through, mind can overcome the body. And the key, according to Viktor Frankl, is finding meaning in your lives, finding a reason not to give up, finding someone and something to live for. So believe it or not, the outcome will be better physical health, better mental health, better academic performance, better beliefs about one's own current situation. So referring to your answers to these questions, these are your meaning in life, or the start of finding out what your meaning is for your life. These are your reasons not to give up. These are the people that will inspire and support you. The answer is not in the situation that we're in that has caused stress and ill health. The answer is in what protects you, so the protective factors that I was talking about before. What does your mind say? What do you say about your living situation, your financial situation, how well you are doing at your studies? It's your perception that buffers the risk. Another quote by Victor. It can be seen that mental health is based on a certain degree of tension, the tension between what one has already achieved and what one still ought to accomplish, or the gap between what one is and what one should become. If you think about that quote, it is about your perception again, where you've come from, where you're going. So in conclusion, although the pandemic continues, the last few years have been an unforeseen experience that have impacted us all in some way. And the research shows from what I've seen in our service is that university students' mental health in New Zealand has been significantly affected during this time, which has had quite an impact on their studies and their abilities. And, you know, the rising numbers, the numbers continue to rise in our service. And the key ideas to take away from this talk today is about protective factors. And from what we've seen from these studies and from what Viktor Frankl has said, so connection with others, how we feel about our finances, how we feel about our grades, you know, being the worst self-critic at times. And of course, finding the important things in your life that give you meaning and reason not to give up, even when things can seem really difficult. So that was sort of all I had to say. And this slide, we have our email address as well. So you're welcome to make contact with us if you have further questions, or if you want to get further support. We are welcome. We're very happy to support you. So yeah, please do send me an email and ask more if you have questions.
Thank you very much, Kim, for taking the time to present to us all this fantastic research and wisdom. I know you have to leave, I think now. So if anyone has questions for Kim, I would ask them to email directly to disability@auckland.ac.nz.
Yeah. Really interested. I just have a really quick question to ask. You know, I think you did. You know, I think most the people here today is researchers